Good evening, my name's Jeremy Hawke. I'm a podiatrist at Hip to Toe Podiatry in Cairns in Queensland. Thank you for joining me. Today we're going to discuss plantar fasciitis, which is a condition which very often leads to heel pain and very often pain through the arch area. The plantar fascia is a structure that actually runs underneath the foot from the insertion in the calcaneus, and it's a band of tissue that runs on the bottom of the foot and inserts in 5 places up here. And what happens to that plantar fascia is it can become inflamed. If the plantar fascia becomes inflamed through this area, you may feel pain at the insertion in the heel, or you may feel pain up through the medial longitudinal arch, up through where the abductor hallucis muscle runs. Very often this sort of pain can be very disabling, and what generally happens is it will be noticed throughout the day as an underlying pain. Very often if you sit down to read a newspaper during the day, or you wake from sleeping and the first time you stand up, you'll actually find that you're feeling quite a bit of pain in this calcaneal insertion into the calcaneus. Now that calcaneal insertion of the plantar fascia actually gets inflamed, so overnight you're getting a build-up of fluid taking place in that area due to the inflammation, the edema being a byproduct of the inflammation process. And when you first stand up in the morning, when the fluid tries to express itself out of those tissues, you can have a very, very sharp pain taking place, which often is partially due to the inflammation and partially due to some of the byproducts of the inflammation that have built up in the tissues. So what can we do about this sort of thing? Well, first of all, one of the things that we do when we see you at Hip to Toe Podiatry is we do a biomechanical assessment and actually have a look at your structural function of your foot, have a look at the range of motion available in your bones and your joints and your tendons, and actually do a study and track back to find out why you're getting the pain. There's quite a few methods of treatment that we can use to actually manage the pain. One example of management is to use an orthotic device, such as this orthotic device here. Now, as you can see, this is a very small orthotic device that will actually fit into a court shoe, and there's other types of devices that will fit into longer shoes, and also there's devices that will fit into running shoes. Now, the difference between these devices, the reason that they are different is because they're fitting into different size shoes and different types of shoes, and they need to be extremely comfortable. So they have to be custom designed if you want a device that is actually going to structurally correct your foot in a scientifically measurable way. So what we're doing with an orthotic device is we're taking the foot and we're taking the bone structure, and what we're doing with the bone structure is we're actually putting the joints, and especially the talus and the calcaneus bones, into a position that will allow the joint between the calcaneus and the talus, the subtalar joint, to function in a balanced position. So that subtalar joint is actually a triplane joint, so it functions in the frontal plane, sagittal plane and transverse plane, and when we put those planes of motion into a balanced position, each time your foot goes through propulsion, it's working in what we call a subtalar neutral position, where the subtalar joint is functioning correctly. The joint in subtalar joint neutral, where very often your orthotics are casted into that position, will allow the foot to function around a more normal position, a position that will allow all of the 3 planes of motion to actually be working in balance. That's one of the things that we can do at Hip to Toe Podiatry. We can also do massage and mobilisation of joints, where in mobilisation we can take the talus bone, we can take the navicular bone, the medial cuneiform, intermediate cuneiform, lateral cuneiform and cuboid, and actually take these bones and slowly move them back into the positions that they actually should be functioning in. Subsequently, what we expect with a treatment plan that may also include therapeutic ultrasound, stretching and strengthening exercises over a period of time, and especially in conjunction with orthotic therapy, you would expect the outcome regarding the pain from heel pain associated with plantar fasciitis to start improving over around about a 6 to 8 week period. Normally within 3 to 6 months the heel pain is actually greatly improved, and there are other management methods that we can look at regarding your long-term management to make sure it doesn't happen again. This is Jeremy Hawke from Hip to Toe Podiatry, wishing you a good day. Thank you very much for joining me. Bye for now.